those pits or depressions in your skin after your acne goes away? Those are acne scars. And don't waste too much money on all these scar reduction creams because they usually do not work. I'm Dr. Tanvi Vaidya, and I'm going to tell you what exactly you need to do to work on your acne scars. Now, this is a sebaceous gland, which is a gland that produces oil. When you get acne, it's essentially because of a blockage here or a blockage here, an infection of the sebaceous secretions within the gland. All of that basically, and it very often happens because of excess sebum production. Now, all of this basically is going to cause an increase in the size of this sebaceous gland because that content is constantly building up, and eventually you're seeing this big bump on your skin surface. Now, when this bump happens and eventually the gland is going to burst, whether you pop it or it pops on its own, it's going to burst. All of this sebum within this gland, this infected sebum, is going to pop everywhere else into your skin, and it's going to cause a lot of inflammation under the surface of your skin. To facilitate healing post the rupture of an acne, what happens is the skin deposits collagen in any haphazard manner, okay? And there is this huge mass of collagen under your skin now that is going to contract again to facilitate healing. Now, this is a very haphazard method of healing which happens because of too much inflammation. When this happens, when the mass contracts, it is now going to pull your skin down, giving rise to these acne scars. Now, there's various types of acne scars. There are ice pick scars, there are rolling scars, there are box scars. There's lots of different types of scars. Irrespective, when we are dealing with these scars, the reason why they occur is because of these collagen bands, the vertical collagen bands within this collagen mass, which are pulling your skin down, giving rise to these scars. Now, there are much higher chances of getting these acne scars when the inflammation is more. So, for example, if you keep touching your acne, if you keep popping it, no matter how tempting it is, avoid doing that. If you do not sun protect adequately when your acne is healing, there is a higher risk of inflammation. Or if you have nodulocystic acne, which is huge, large cystic acne, your chances of scarring are much, much higher. Also, there's a very interesting component to this, which is genetic factors. So there is a lot of papers nowadays being presented about, two individuals with the exact same kind of acne, same grade of acne, who are not touching their skin, adequate amounts of sun protection. One may scar and one may not. That is because of a genetic tendency of your skin to scar in response to injury or in response to acne. So acne scarring has a major genetic role as well. Now, how do you prevent it? You have realized that, okay, you have acne and you have a tendency to scar, so how do you prevent it? For one, treat early. Do not waste time. I have seen so many, typically teenagers, they come in with whether it's mild acne or severe acne. People at home typically tell them that, this is a pubertal thing, this is a teenage thing, and it's going to happen, and as you enter your 20s, it's going to get better, your acne will just go away on its own, so don't worry too much, don't fret about it. But what about your acne scars? You're going to be stuck with your acne scars for a really, really long time. Your acne may go away, that too I would add a very big may here, but your acne scars are not going to go away without treatment. So don't waste time. Don't try too many home remedies with like lemon and toothpaste and whatnot on your skin. You'll end up damaging it further and your acne may not go. So get a dermat's advice to help you fix your acne soon before it scars. Next, sun protection is super important. When your acne is healing, you do not want sun exposure to add to the inflammation that is in your skin. And lastly, I said it already, do not touch your skin, do not pop your pimples, do not touch it, do not scratch it, just leave them alone and let them heal on their own. Now, how do you treat these acne scars? First of all, treat your active acne, and that's a separate discussion altogether. I have a separate video talking about that, which you can go and see later. Once you've treated your active acne through, whether it's just through skincare or through procedures or through oral medications, whatever it is, you need to come to a stage of maintenance skincare. You may need to use maybe some topical retinoids once or twice a week also, just to prevent new breakouts of acne, because there's no point treating your scars or the sequelae of your acne if you're only going to keep getting new acne and new scars. So that's super important that you have to completely stop breaking out before we start getting to the stage of treating your acne scars. So get onto a maintenance regimen, and then once you're good for a month or two and you're all settled, that's when we'll start treating your acne scars. Coming to treating acne scars, the first step is to identify, are these really scars or is this post-acne pigmentation or post-acne erythema? Post-acne pigmentation is the brownish or blackish spots that will stay behind on your skin, which is just a pigmentation. There's no textural difference. There's no pit or depression in your skin. It's just the color that is brown or black. Post-acne erythema is redness that develops post your acne. Both of these can be treated beautifully through just topical medication. Azelaic acid works beautifully, kojic acid, glycolic acid, all of these work beautifully on post-acne erythema and post-acne pigmentation. Also, if it doesn't settle through topical skincare, then we need to consider chemical peels or pico laser toning. All of this works really beautifully on treating those. But if you are left with acne scars, which are the pits in your skin, then you need to really go in deep and we need to treat those collagen fibers that are pulling your skin down. Coming to the treatment. Now, most products topically do not work on acne scars because a major collagen boosting is required. You need to go in and break those scars. But if at all any topicals have to work, it is topical retinoids. I'm not talking about retinol serums. I'm talking about prescription grade stronger retinoids like adapalene or tretinoin. But these are prescription grade. Do not use them without the prescription of a dermatologist who knows how to use it and the strengths, the limitations and all of that. So don't start this on your own. But if at all anything is to work, it's that. What is the mainstay of the treatment of acne scars is usually procedural therapy. So we, let's get this straight, have to go down to those collagen vertical bands which are pulling your skin down. We need to break those bands and now we need to boost normal collagen production which will help lift those scars, right? So how do we do this? The oldest and the most commonly done procedure earlier used to be something called subcision. In subcision, what I do is I literally first infiltrate local anesthesia. I go under the surface of your skin with a needle and I am going to go all around under the surface of your skin just like this and I will break those bands. Literally when I do this, you can actually hear this mild sound of cut, 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 cut. You can hear those bands literally breaking. So it's a really effective procedure, but yeah, it's a little scary for patients because, you know, when I literally tell them I'm going to be passing a needle under your skin, patients get a little worried. But in any case, now we don't do just a basic subcision anymore. We do something called an RF subcision, which is subcision in which the needle also delivers a radiofrequency energy under your skin. So it also helps to boost that normal collagen. So subcision is a great treatment, but now we have replaced it with RF. Next, coming to derma rollers. Now, derma rollers is something a lot of you might have Googled about or, you know, seen a lot of these influencers promote very often. People do it at home and all of that. But frankly, it's outdated again. What derma rollers are is essentially there's a cylinder. And all around the cylinder, there are these tiny needles, micro needles all around the cylinder. And you have to roll the cylinder on the surface of your skin. So these needles are penetrating your skin and producing like this linear track-like injury to your skin, which helps with collagen boosting. Yes, agreed, it does help with collagen boosting. I'm not saying it doesn't. But frankly, the role is a little limited because there's no energy that you're delivering. It's just a physical trauma of those needles going in and out. Now, the risks of doing derma roller at home is firstly a lot of infection. Secondly, why it's outdated is because of those linear tracks that it produces. Rather than an in and out motion of better microneedling devices, those linear tracks are too traumatic to your skin. So the kind of damage that is happening is not the best kind of damage that you want for your skin to start healing better. Also, there's a risk of pigmentation if it's not done properly, and the risk of infection is super huge when done at home. So derma rollers are really not something that I would advise. It's also not going to give you that much of a lift in your scars, nothing very significant. Next, coming to lasers. Now, lasers like the fractional CO2 laser, the erbium YAG laser, what they basically do is this laser light goes right into your skin up to the level of the dermis, where those laser beams are fractionated so the trauma isn't too much, and they cause new collagen production by stimulating again this injury. Now, though it works beautifully, it's one of the best treatments for acne scars, but the only problem with both of these lasers is the downtime. For almost a week, there's a lot of redness on your face, there's a lot of scarring and scabbing on your face for almost a week. Now, I personally find it very difficult to find a patient who's willing to sit at home for a whole week post procedure, because these procedures are all done, in sittings. You do one sitting every month for about 4 to 6 months. So who's going to sit at home for 1 week every month? That's a lot to expect from a patient. So the next treatment that I was coming to, which is my personal favorite, is something called MNRF, which is microneedling with radio frequency. In this, we first apply a numbing cream. There's a machine with a probe that literally has multiple micro needles that penetrate your skin. They go in, they deliver a radio frequency energy, and they come out. When this happens, we do it at 3 different depths. When this happens, you are breaking those collagen bands and you are forming new collagen. And the benefit is, over the lasers, is that the downtime is only about 1 to 2 days. MNRF also gives you the added advantage of a skin tightening, fine lines, pores, all of that also tightens. A little bit of sag gets corrected. So those are the other advantages of doing MNRF. In saying that, when I say that you're going to get great results and you're going to fix your acne scars, are you going to go to 100% scarless face with no texture, no pores, no pits? No, I would be lying if I told you that. I need to give you a realistic expectation of what you can expect at the end of it. Each scar lifts to about an 80%. That's a realistic expectation. It's not going to go to 100%, but an 80% itself is pretty good in terms of, the final texture that you get and the final result that you get. Other than these, there's a lot of other procedures as well, like TCA cross, which is for ice pick scars. There's something called a punch excision of your scars. There are fat grafts that can be done under the surface of your scars. There is subcision followed by fillers that can be done. So many different approaches are now coming up. Every day we see newer and newer technologies coming up for the treatment of acne scars. If you have any more questions about acne scars, how to treat them, what difficulties you have felt while you were going through your treatments, do ask me in the comments and I will be happy to answer them for you. Also, don't forget to hit the subscribe button to see more such videos about skincare.